Hello, this is Anthony Rota, Member of Parliament for Nipissing-Temiskaming and Speaker of the House of Commons. With the COVID-19 pandemic having a major impact on our lives, I wanted to reach out to community leaders and business owners around the riding and check in on how they have handled the last year. Now, March 11th was the first National Day of Observance with COVID-19, honoring those that we have lost and the many friends, colleagues, and family members they have left behind. We also look to honor the many healthcare and essential workers who have put themselves at risk to keep Canadians safe and healthy and recognize those who have experienced sacrifice over the past year. With that in mind, I'm happy to be joined today by Dr. Jennifer Mihill, head of Anaesthesia and the COVID-19 critical care preparedness lead at the North Bay Regional Health Centre, as well as Tammy Morison, the president and CEO of the North Bay Regional Health Centre Foundation. Tammy, Jennifer, thanks for joining me today. And it's a pleasure to see both of you out and, out. I guess that's kind of a metaphorical thing, but it's nice to see you online, and thank you for joining us today. Just a quick question for both of you, if you don't mind. The last year has been an interesting one, as I stated earlier. How has that changed what you do on a daily basis?
You know, a lot of things have changed, obviously, for everyone, not just us here at the hospital, but a lot has changed in all areas, I would say, of my life. At work, for sure, because we implemented a lot of new protocols that we've never done before. And, you know, I've had to learn to do procedures in a different way that I had ever done them before as well. We made a lot of changes here at the hospital in terms of physical space, the type of gear that we wear, the way and the type of procedures that we do in order to maximize the safety for us and for the nurses. So it's been a big year of change. Of course, at home, it's different for me as well, because I have two little kids, and so they're trapped in the house with my poor husband, driving him crazy. And, you know, we have to sort of move through the community in a different way and interact with people in a different way. And so, you know, it has been challenging, but you know what, from all those things we grow too, because we've made a lot of improvements actually in the hospital and in our department too. So it's been very different, but there have been opportunities there as well.
Perfect, and it's nice to see the opportunities being taken advantage of, or at least, what we're doing right now, just with Zoom, is interesting as well, because it means technology that, yeah, it was there a year ago, but we really didn't maximize it. Tammy, how about you? What do you see here in the last year that you've changed, or how has it affected you?
Thank you, and thank you for having me. And yeah, absolutely, Zoom. We used to have conference calls, you know, with colleagues and associations and donors and such. And I can't remember the last conference call I had since Zoom came on the scene. So certainly it's been great. But, you know, at the foundation, we really started shifting our focus and finding creative ways to engage with our community. So we are connected in our community and we do most of our work in our community. So that immediately changed, and we had to be behind our desks and figure out how we can still engage with donors, still engage with our community, tell our stories in a meaningful way. We started using more video. So you might recall our memorial video with General Ron Button. That was a great example of how to, you know, demonstrate our gratitude to the families, you know, mark our memorial reception that we usually have annually in person, and just do that in a more innovative way. We started having more meaningful conversations with our donors over the phone. We had donor check-ins. We'd immediately when the pandemic was declared, we started just calling everyone. We wanted to make sure everybody was okay, and to know that we are still here. I also found people were home. I was not leaving any voicemail messages. So that was delightful. And then, you know, as some restrictions eased into the summertime, we started having some porch front visits with our donors at a socially distant way. We were able to, you know, adjust some of our activities so that they could still happen. We could still see our donors, but of course, being compliant with the public health restrictions. And, you know, we'll continue with that. A lot of those things, you know, it's certainly to the end of the pandemic, which I hope is just around the corner. But even beyond, I think that some of the technology has made it easier for us to connect and stay connected.
Perfect. Now, using the technology and using what we have at our disposal is something that's really, I think that's probably the biggest lesson from COVID-19. Speaking of lessons, learning about the virus. I mean, COVID-19 is something, or COVID, I guess, and coronavirus is something that's been around for a while. But maybe from a medical point of view, adapting to the changes, because I know from a political point of view, you're trying to kind of figure out in the dark exactly where you're going and what's going on. How has that been from a doctor's perspective on adapting to the new information coming out and making sure that it gets across in a good way and implemented correctly?
Well, it's safe to say that that has been a challenge, as I'm sure you can appreciate, because it's like that in politics too. You know, we, as you said, had several other coronaviruses that we are familiar with as doctors, and you know, had a treatment plan that we generally use for those. But we found out quite quickly that coronavirus acts in different ways and isn't as similar to the other coronaviruses as we thought. And as you said, you know, we had the European information being fed to us, mostly just, you know, anecdotal, as we hadn't had the chance to do any true studies. And then looking at what other countries were doing and watching what was happening and realizing that it was coming here too, and we would soon be faced with it. It's very challenging. In medicine, we like to have our studies. We like to have things tested for years. We like to know that they work before we use them. And here we were using treatments sort of on the fly, hoping that we were helping and not doing harm. And, you know, there was a lot of trial error at the start. I think now, you know, we're a year in and we actually have learned quite a bit about this coronavirus. And we certainly have decreased mortality with the way that we treat patients. But I can tell you when it first came, it was a really scary time to be a doctor, because it's very scary to watch your patient have a disease that you don't really know how to treat. And it's very scary to come into an environment where you don't know the real epidemiology of the disease, and it's ever evolving, and you wonder, am I going to get this? Will I bring it home to my family? And for the first time in my career ever, and I'm in anesthesia, so it's kind of a scary specialty at times for us in terms of stress, but I've never felt scared for myself or my family. And that was something different that got into the mix. And so that was a really hard time those first few months, but we just took it head on. And, you know, that's what we do in healthcare. And we just did the best that we could with the information and the medicines we had. And we've continued to evolve, and we continue to do that. So, you know, I think we have come a long way. It's been a lot of work, but it's been worth it.
Yeah, it's kind of interesting because, I mean, you really don't have a choice. You've taken an oath. You want to make sure that the person in front of you gets healed. Sometimes at your own expense. Well, we hopefully not at your own expense, but there's always that risk, and that's something that has to be in the back of your mind and a real concern. Now, Tammy, you mentioned all the new ways you were contacting people, and I know that happens often where you see people actually coming together and working and doing different things. And have you ever just sat back and thought, wow, they're really doing a good job?
Absolutely, thank you. So we have a very diverse fundraising program. We have incredibly innovative and creative staff on staff here at the Foundation, but we also have you know, our board of trustees and community committee volunteers. So we always have that connection to our community. And a couple of my committees, I call them my idea factories. And so just continually engaging with all of those individuals and determining new ways of doing things and trying to also maintain that diversity in our program. So for instance, the introduction of our Hospital 50/50 and you know, doing Golden Heart Award presentations on Zoom, but still you know, engaging that internal and external community in that meaningful way. We've had so many great things happen by others in our community, and I'm really proud of the way that our community has responded to the needs of other, and in particular, you know, our health center and those needs. And giving can be such an empowering experience. And so during these times, I think we can all use a little bit of empowerment. You know, I've got Canada College students currently working on some virtual events to help engage people in our community, have a little fun on the side, raise some money as well. Of course, the cooking class with Dr. Singh, we had 2 rounds of that, and stay tuned. I think we actually might have another one coming up in June. Just a little plug for Dr. Singh and his cooking class there. But we also reconfigured golf tournaments so that we could comply with, those restrictions. And, the community really adapted to help our hospital as much as we adapted to help our community.